we're going to talk about bunions. What is a bunion, what causes it, and how we can treat it. A bunion is a growth of bone adjacent to the big toe. So we have the big toe, and the bone that leads up to the big toe is the metatarsal bone, and over time this bone can start to splay out and a bony growth can be present here, and the big toe starts to drift over to the other toes. A bunion is something that is usually hereditary. Certain types of foot structures will lend themselves to causing a bunion. Usually it's a patient that has a flatter type foot where we have something called pronation occurring, and certain tendons will create an imbalance and will lead to this deviation of bone. And then we start to get some changes within the joint after the bone has deviated. Typically patients will have pain at the bump first due to pressure from shoes, and if the deformity continues, we'll wind up getting some pain inside the joint as the joint starts to wear unevenly. Now there are some bunions that are very large. They do not cause any pain. Some bunions are very small and will cause a lot of pain. So there is a wide variety of pain that patients experience. But certainly if you're having some discomfort in shoes and you notice the problem starting to get a little bit worse, you probably want to have it checked out. So when we see a patient with a bunion, we can have, again, a lot of different types of bunions in different sizes. So what we'll typically do is to take an x-ray to evaluate a patient's bunion. So there are two basic ways to treat this, both conservatively and surgically. Conservative treatments usually involve a wider shoe, preventing pressure where that bump is. And sometimes if the area is inflamed, we can incorporate some anti-inflammatory medications, injections, or padding. Now these modalities are temporary, but sometimes can provide the patients with a lot of relief. The way to get rid of a bunion permanently is with a surgical procedure, and the procedures to fix bunions have come a long way over the last several years. When we fix a bunion now, what we want to do is we want to remove the bump that's present, but we don't want to stop there. We want to align the joint correctly so that this problem does not reoccur. So with this particular patient, a pretty large bunion area, a lot of pain here on the side of the foot. And this is the patient after surgery where we were able to align the joint correctly so that it's going to wear in the proper mechanism and we don't have any kind of shift with the bone. As you can see here, what we use is a couple small screws, and with the advent of these screws we have patients walk in their foot right away. We usually have them wear a shoe like this for about 2 to 3 weeks and then back into a sneaker, so it's not a long period of crutches. When we have patients with a very large bunion deformity, sometimes that will necessitate doing a different type of procedure where we have to put patients on crutches, but probably about 90% of the time we're able to do this and have the patients walk in their foot the same day we do it.